Yes.
All right. Good morning, council members. It is Friday, March 5th, 11:01 a.m., and I'm calling the Texas Early Learning Council meeting to order. I'm Reagan Miller. I'm the director of the Childcare and Early Learning Division at the Texas Workforce Commission, and I want to welcome all of our council members and guests who are attending today. So first, we're going to cover some meeting logistic information. This is a WebEx produced meeting event, and members, presenters, and staff are able to participate through the WebEx Live Events virtual platform. I want to remind all of our members and folks attending to keep your electronic devices on mute when you're not speaking. That'll help with a lot of the background and static noise. Shay Everett is helping to facilitate this meeting, and if we forget to mute ourselves, then she will mute for us. Remember, when you speak, to state your name each time before you speak, so that we know who's talking. And with that, let me introduce Shay Everett. Many of you know Shay is a senior advisor of the Child Care and Early Learning Division at TWC, and she is serving as today's meeting facilitator and our WebEx producer. Shay.
Yes, and as many of you know, we have not had a permanent chair for the last few meetings. So thank you all for your patience and your assistance as we were working through that. But just a couple of weeks ago, the governor has recently appointed the new chair, which will be Miss Reagan Miller. And so we're taking things a little bit out of order. Number 5, we're just going to announce right now, and I will turn it back over to you, Reagan.
Yeah, so members, I am excited to have been appointed by Governor Abbott as your new chair. The first thing I want to do is thank Stephanie Rubin. She has been our acting council chair since last May. The council certainly had a lot to consider during the pandemic, and I think I speak for all of us when I say, Stephanie, thank you very much for helping lead the council through this time. We really appreciate that you were here and able to step up and help us as a council as we navigated through the pandemic. And then I just want to tell all of you, I'm excited to be serving as your chair. Really look forward to working with you in the coming months as we all work together to collectively consider how we really help best address the needs of our young kids. So with that, we will get to our next agenda item, which is agenda item 3, the approval of the draft meeting minutes. So I would like, Shay, are we ready to go? Are we good now to go to meeting minute approval?
Yes.
All right. So members, if you will find those draft meeting minutes in your packet, and then I'd like to see if anybody has any edits or changes to the draft minutes.
I do have some changes. I can say them aloud. I also put them in writing and sent them to Shay this morning, but I can put them in the chat box, whatever easiest. It's really a minute detail. How would you like me to do that, Reagan?
I think if you could say verbally what the correction is, that way all of the members will be aware.
Okay, it's simply that I am listed as the chair of the department, which I am no longer at HCC, and I haven't been for about a couple of years, so I must not have been paying attention to these details. I am faculty and program coordinator for the child development program there.
Okay.
I'm also technically here as the representative of the Child Development Educators Association of Texas, technically.
Okay, perfect. Thank you for those corrections. So with those corrections, is there a motion for approval of the minutes?
Motion.
And please state your name for the record.
Oh, all right, Kathy Abba, I will motion to approve the minutes.
All right, Kathy, thank you. Is there a second?
Kim Coffin will second.
Thank you very much, Kim. The motion has been seconded. Shay, will you conduct the vote?
Yes, I will conduct a roll call vote to approve the January 2021 draft meeting minutes with the revision of Catherine Abba's title. Please reply for, against, or abstain as I call your name. Catherine Abba.
For.
Chelsea Holden is not here. Sarah Abrahams.
For.
Travis Armstrong.
For.
Weldon Beard is also unable to make it today, so I'll move on to Terry Breeden.
For.
April Crawford.
For.
Alferma Giles.
For.
Melissa Horton is also unable to make it today, so I'll move on to Becky Huskeeler.
For.
Kim Coffrin.
For.
Jerletha McDonald. You might be on mute.
For.
Perfect, thank you.
Thank you.
Dana McGrath.
For.
Reagan Miller.
For.
Julie Richards.
For.
Teresa Robledo is also not on the call yet. So Stephanie Rubin.
For.
Amber Scanlon. You're on mute. Unmuted you.
Oh, 4, thank you.
Kirsten Schwab.
For.
June Yeatman.
For.
And Audrey Young.
For.
Thank you. The motion to approve the January 2021 draft meeting minutes has carried with the revision of Catherine Abba's title.
Wonderful. All right. Thank you, Shay. Members, our next agenda item is public comment. We did have several folks request to speak to the council today. Shay, I'll ask you to facilitate this portion of the agenda for our public commenters.
Wonderful, thank you. As a reminder to everyone, earlylearningtexas.org has a section called meetings. This houses the meeting dates for all of 2021, as well as the agenda as it's released. Public agendas are posted at least 1 week prior to the meeting date and include the WebEx link along with instructions for submitting public comment. 5 registrations were received to provide public comment prior to this meeting, so I will get started. I'm going to call on each commenter by name and let them know they have 3 minutes to provide oral comment. You will hear a chime at the 2-minute mark and then again at the 3-minute mark. Texas Early Learning Council members may ask questions following each of the commenters. We're going to try this a little differently this time. And then the first one is going to be Reagan Horchow, which I will go ahead and allow you to unmute yourself. Reagan.
Okay, can y'all hear me?
Yes, please provide your name, organization, and the agenda topic you're commenting on for the record.
Sure, and I'm sorry I don't have video. I can't figure out how to do it, but that's okay. Y'all don't need to see me. Reagan Horchow, I am the board chair for the Early Matters Dallas Advisory Board. Ready?
Yes.
Okay. First of all, thank you for the opportunity to speak. I'm speaking both as the chair of the advisory board, but also as an individual citizen of our state who's had decades of interaction with the state agencies charged with the care and education for our youngest citizens. I'm sorry, the topic I'm talking about is cross-agency website. That was the other thing you asked me. I'm here to urge the acceleration of a process that will result in better coordination of data across state agencies, including, but certainly not limited to, a cross-agency website. Early Matters Dallas funded a software development work that enabled the frontline childcare vacancy tool to be deployed within a few weeks when COVID impacted the availability of childcare. We had funded the software development pre-COVID to enable childcare programs to register enrollment attendance through technology platform, which would, with a single entry, meet the requirements of TWIST, TEA, and their internal financial and collection needs for their businesses. This is just one example of how a better integrated system could improve the sustainability of childcare and the interactions our families have with the state systems. There are many examples where lack of integration causes extra work for all users. For example, right now, Austin's Pre-K Partnership Hub staff are currently manually entering immunization data into 3 different systems for the more than 300 students who are co-enrolled in different early childhood programs. Currently, when asked by our legislators or anybody else, how many children are in a quality early childhood setting, asked about any region, we can't answer that question because some of the same types of enrollment data is defined and housed differently in each state system. We need better integration. Other states have done this. We have focused on a governance structure which will allow each agency to both maintain the integrity and privacy of the information they collect and integrate that information with other state agencies. I urge the Texas Early Learning Council and the Governor's Office to form a work group and to consider the use of federal funds to engage with experts who've worked with other states on these issues. Thank you.
Thank you, Reagan. Any questions from members? Stephanie?
Hi, Reagan, this is Stephanie. I wondered, I like your idea of a work group. Do you have a sense from being somewhat deep in this over the last couple of years of what some of the top priorities should be, or what you think the council should kind of seek to accomplish over in 2021, just as an example?
Well, I mean, I think the low-hanging fruit is just enrollment data. If we could make, first of all, make it easier for us to answer the question, where are children and what kinds of programs? And then secondarily, if we could make it easier on our programs to interact with our state systems without having to without having to enter duplicate places. I mean, I think that's just a great starting place. There are obviously lots of other opportunities for coordination, but just getting basic enrollment data consistently reported would be a huge win.
Thanks.
Anyone else?
Thank you for those comments, Reagan.
Thank you all.
Thank you. Moving on to Chuck Cohn. One moment. All right, Mr. Cohn, if you'll state your name, organization, and agenda topic for the record, you'll have a chime at the 2-minute mark and then another at the 3 when the time is up.
Sure. Can you hear me? Great. So my name is Chuck Cohn. I'm the owner of Angels Care and Learning Center in Austin, Texas. The agenda item that I'd like to discuss is COVID updates. Just one quick comment on the previous person's, which I think is a great idea with the work group. I would say one of the benefits of combining that data would be to really target the underserved areas, especially like I know in our city of Austin. I would love to have the data to be able to say, hey, where are kids not able to access quality childcare? Because then people like me that are in the for-profit sector can actually potentially move in there. So I just wanted to, I wasn't prepared to say that, but I really think being able to get all that data together would be an incredible thing for me to be able to do to hopefully help out our community. But back to my prepared comments. We're a Texas Rising Star 4-star center. We have a capacity of 90 students, and about 80% of our students are receiving tuition subsidies through the Texas Workforce Commission and also through other organizations like Austin Community College. Despite the challenges that COVID brings to an educational environment, we started participating in the Austin Independent School District Pre-K Partnership Program administered by United Way of Austin in 2020. The Pre-K Partnership Program has done so much for us, for our program, but most importantly for our families and children. And I say that not just out of education, but being able to have that synergy with workforce development and helping our families get out of poverty. But most importantly, it significantly improved the quality of all aspects of our program for all ages, even beyond the quality expected in the Texas Rising Star program. The recipients of this quality from the pre-K partnership program are our most economically disadvantaged Texans. The maximum benefit that we attained from pre-K partnership would not have been possible without the administrative hub that United Way of Austin has in place. Really, the complexity of managing the requirements for licensing Texas Rising Star, the public pre-K program, those can be significant barriers for a lot of private or nonprofit childcares for participating in these type of partnerships. And so to have a hub like the United Way continue to be that administrative hub is really a promising investment that could help expand pre-K access for families while leveraging valuable funding and supporting to help childcare programs sustain quality programs. United Way was invaluable in that they eliminated that administrative burden for our small staff, but also connected our teachers and students with the immense resources that United Way and an organization like that brings to the table. Without their administration, the training, the network resources that they provided, our task of implementing pre-K partnership in the middle of the COVID pandemic and the related weather emergencies really would have been difficult at best. Going forward, I highly recommend that consideration be given to dedicating some of the child care development block grant funding to bolstering the pre-K partnership program and maybe looking at implementing administrative hubs such as the United Way to help administrate and execute this program. And that's all I have. Thank you.
Thank you so much, Mr. Cohn. Does anyone have any questions for him?
This is Reagan Miller. I don't have any questions. I appreciate your comments, and when we start discussing some of our COVID work and the use of the new funds, I think you'll see some of these thoughts reflected on those preliminary plans. So thank you. Thank you for being here and providing those thoughts.
All right, thank you for all you do.
I have a question for Chuck, just quick. Chuck, this is Stephanie Rubin. I know, you know, in I think at least the average statewide was a big drop in pre-K enrollment in schools. We, of course, as Reagan brought up, don't have the data really to know where those kids are, if they're at home or a child care center. Do you have any sense locally whether, you know, some of those kids who might otherwise have attended public pre-K might have gone to child care, or you know, have you and your colleagues been able to figure out what some of those families are doing?
Well, I can specifically comment really on the school age side. You know, surprisingly to us, we saw a lot of kindergartners and first graders actually come into our center because we were a source of stability where they could conduct online learning and do it in a safe environment, and then facilitate their parents being able to continue to work. So that was a surprising development. And even with as schools open, we still are seeing school age children. As far as pre-K, it's really hard for me to quantify that, but I would say that I think what we've done is we've provided that pre-K, and had we not had the program at our school, it probably would have been a couple of dozen kids that never would have even had that pre-K experience at such a high quality level. So it really did, I believe, it increased the number of kids that we're able to serve and provide quality to.
Okay. Thank you so much. Moving on to the next commenter is Kaylee Hernandez. Everyone should have also received a handout in your packet from her. It's the Children at Risk handout. Kaylee, if you want to state your name, organization, and agenda topic you're commenting on for the record, and go ahead with your comment.
Good morning, Kaylee Hernandez, Children at Risk, and I'm commenting on COVID-19 updates. Thank you so much for the opportunity to talk about the impact COVID-19 has had on childcare centers in Texas. Along with this oral comment, I'm submitting a brief on childcare closures from the time period of March 7th to August 7th, 2020. I want to first provide a snapshot of childcare closures as of August 17th, 2020. 13% of subsidized childcare centers were closed compared to 17% of non-subsidized childcare centers, as well as 14% of Texas Rising Star centers closed versus 27% who were not participating in TRS, with 25% of all childcare centers closed. The disruption in the supply of childcare led to a dramatic increase in the number of childcare deserts in Texas from March to August of 2020. And so In September of 2019, there were 393 childcare deserts in Texas, and 184 communities became new childcare deserts as of August 2020 because of the lack of consistency in available childcare. The closures for this time period resulted in lost childcare capacity. Across the state, 20% of available childcare capacity was lost due to closures. Texas Rising Star providers lost roughly 11% of their capacity, and a little over 11% of subsidy seats were lost. The loss of these subsidized quality seats means that fewer lower income families have access to affordable quality care. Before COVID-19, childcare was in short supply and cost more than parents could afford in many communities across Texas, particularly for communities of color. Our analysis showed that communities most likely to experience closures were communities of color and communities with higher levels of higher education. Our key findings revealed that subsidized childcare centers were better able to remain open compared to non-subsidized centers, suggesting that subsidies and additional government relief dollars provided much needed stability. Childcare capacity decreased by 20% across Texas at the height of the pandemic. Critical infant and toddler seats were lost across the state, and in communities of color, childcare centers overall were twice as likely to have extended or permanent closures. Texas will receive approximately $1 billion from the Coronavirus Response Relief and Supplemental Appropriations Act. Based on our analysis, Children at Risk makes the following recommendations to improve access to quality childcare, stabilize the childcare industry, and meet the needs of Texas families with young children. We need to provide weighted grants to support financially vulnerable childcare programs both in and outside of the subsidy system, provide business supports to stabilize childcare businesses to help centers secure eligible PPP and other funding opportunities, and provide wage supplementation for early educator retention to be used to provide stipends to incentivize retention and stabilize the supply of childcare. Thank you for your time, and I'm happy to answer any questions.
Thank you so much, Kaylee. Does anyone have questions? No? Okay, that was a lot of information. Thank you for that in the handout. Moving on to the next commenter is Jess Trudeau. Please go ahead and state your name, organization, and agenda topic for the record.
Thank you. My name is Jessica Trudeau. I'm the Director of Strategic Initiatives for Tex Protects and serving as the backbone director for the Texas Prenatal to 3 Collaborative. Thank you for the opportunity to provide an update on legislative strategies to expand the Family Connects program on behalf of the Texas PN3 Collaborative and Tex Protects. As shared with the Early Learning Council last November, Family Connects is an evidence-based program that coordinates care and aligns existing resources. After giving birth and prior to discharge, a nurse home visit is offered to all families in a community, currently within a defined and targeted catchment area, to assess family health and well-being and provide access to resources, including childcare, at approximately 3 weeks postpartum. Family Connects has been demonstrated successful at connecting families to critically needed resources, as well as reducing reported maternal anxiety, substantiated cases of abuse and neglect, and emergency department hospital visits. Additionally, and to ensure alignment of resources, the program is being implemented in close alignment with resource and referral systems such as Help Me Grow and other home visitation programs. In 2019, 1,239 families, and in 2020, 1,844 families successfully completed at least one Family Connects visit in Tarrant, Bastrop, Bexar, Travis, and Victoria counties. Dallas County programming will initiate shortly. Family Connects has a high return on investment at $3.17 for every dollar spent, with a strong base of empirical evidence supporting efficacy. For these reasons, Tex Protects is advocating for expansion of programming. To date, House Bill 2333 has been filed by Representative Howard's office to establish an administrative home for Family Connects for the dissemination of funding through a competitive grant process. Simultaneously, we're working closely with Representative Howard's office on strategies utilizing the existing budget to draw down unspent federal dollars. We welcome the support of the Early Learning Council in this endeavor to improve outcomes for Texas children, and I'm happy to answer any questions at this time.
Thank you so much. Does anyone have any questions for Jess Trudeau? All right, perfect. Well, thank you so much for your comments. Moving on to the next and last commenter is Davida Clary. I will unmute you. There you go, Ms. Clary. If you would provide your name, organization, and agenda topic you're commenting on for the record.
Sure. I'd like to start by saying congrats to Reagan. My name is Davida Clary, and I'm the owner of Wonder Years Infant Center and Preschool. I will be speaking on expanding partnership support for COVID recovery. My center is located at 48th and Grover Avenue in Central Austin. At the onset of the pandemic, we kept our doors open to serve essential workers and are currently assisting school-aged children with virtual learning. I am extremely grateful for the financial assistance that helped to sustain our industry. I am hopeful to rebuild our enrollment to pre-pandemic numbers as the economy continues to reopen. I've been a proud participant in the Texas Rising Star program since 2008 and have consistently maintained a 4-star level. I am licensed to serve 62 children and proudly serve, on average, 40 to 50% subsidized children. I can attest to the impact the TRS program has had on quality as a result of the state's continual improvement objectives. The program has been successful, ensuring that every child has access to quality early learning. I can also attest to the benefits of participating in the Pre-K Partnership Program. Participation in the program offers more than a financial benefit. The partnership program takes quality to the next level. The creation of the United Way Hub has made a significant impact on the delivery of the Pre-K Partnership Program because they addressed and removed industry-specific barriers. The TEA's mission is to provide public schools with leadership, guidance, and resources. Early learning providers do not have a centralized source for these very necessary support systems. The United Way Hub, through the Pre-K Partnership, provides those support systems and more. Through their collaboration with various organizations in the community, we have received invaluable resources that contribute to attaining an overall quality program. We have a path for teacher certification. We receive recruitment assistance for EC certified teachers in our program. We have a substitute pool. We have structured professional development and financial assistance for additional costs. And the Hub is currently working on other support services that align with ISDs. These and other vital resources are not provided in the Texas Rising Star structure. Therefore, it is imperative that lucrative financial support for pre-K partnerships and the system supports like the United Way Hub are sought out and approved. In our pursuit of continuous improvement, let's not forget that early learning facilities and homes are typically a family's first introduction to education. Let's make sure we offer the best experience by ensuring we continue to collaborate on the highest level possible to offer seamless educational services. We currently have the opportunity to set the direction for early learning. Supporting collaborations between quality early learning system and the public pre-K will expand access and quality for all children in Texas. Thank you.
Thank you so much, Ms. Clary. Does anyone have any questions for her?
Thank you very much.
Perfect. Appreciate it. And that concludes our public comment portion of the agenda.
Okay.
Reagan, I'll turn it back over to you.
Thanks. I really do appreciate all the members of the public that come forward to share this kind of input with us. I think it's really important that we continue to hear from the public on issues that they find important. So I really thank all of you guys for joining us today and sharing your thoughts. The next posted agenda item is number 5, but we have already considered that regarding the appointment of the chair. So that takes us into agenda item number 6, COVID-19 updates. So I do have some updates to share, but before I want to talk about the $1 billion, a lot of money coming to Texas in the Childcare Block Grant. But before I do that, I think we're all aware, and I just want to acknowledge the instructions that came out this week on vaccine prioritization. The federal administration issued that guidance that all educators would be covered, and I was incredibly happy to see that our dishes partners issued instructions that afternoon to all vaccine providers that educators are prioritized. And I know that we at TWC sent out an email to our distribution lists to make sure that folks are aware of this prioritization. I know that the Texas Education Agency is looking into this. Julie Richards and folks at Childcare Regulation are. So I think we're just all incredibly happy to see that this prioritization has been implemented. All right, any questions or comments around this? Stephanie, I know this is something that you have been asking about, so. All right. So I guess with that, I'll take us to the next update that I was going to provide on we're calling them the SRSA funds, COVID Relief and Response Supplemental Appropriations Act of 2021. It's a long name, but these are the funds that Congress recently approved, and Texas is going to receive $1.1 billion. There was a report that was due to the Office of Child Care within 60 days of the date of enactment. So that report was due by February the 25th. So TWC's 3 commissioners did approve a plan on, it's a high-level plan on investment strategies, the planned use of funds report, and this was posted on our website. Shay, I don't know if you can bring up that plan. This plan follows the organizational structure that the Office of Child Care asked all of the states to use. They provided some categories and asked states to provide responses based on these categories. I will say that prior to the development of this federal plan, we did host a stakeholder webinar on February 5th and posted information on our webpage as well. So in this planned use of funds report, you'll see that we're receiving $1.1 billion. The first category that the Federal Office of Child Care asked us to address were direct child care services and subsidies. And you'll see that one of the considerations that we're making is to increase the amount of funds that are allocated to our local workforce development boards to increase the number of low-income families that are receiving child care subsidies. The second area that the feds asked us to address were the implementation of virus mitigation policies and practices. Now, this is one area that after some discussions with our partners at Childcare Regulation, we have not heard that there's a need to expend any of these additional funds in this area. There were a lot of steps that were taken previously to provide information out about mitigation strategies. The Health and Human Services Commission did have some emergency rules, and there was a checklist that the Frontline Task Force put out, as well as the Texas A&M AgriLife online trainings. So at this point, we have not heard that there's a need to make any additional investments in this area. And when we hosted our stakeholder webinar, at this point, we haven't received any input that folks think that there's a need in this area. So our current planned use of funds report, we indicate that we at this point don't have any plans to invest in this. The next bucket is grants or assistance other than subsidies to stabilize childcare providers. And so this is where we've had a great deal of discussion about how we would support not only subsidy providers, but all CCDF eligible regulated providers. So in Texas, we'd be talking about licensed centers, licensed homes, and registered homes. This is the area that we have been considering implementing first. This is a lot of money, so we'll certainly have to stage the rollout of all of these different initiatives, but this is the one we're focusing on first. As we said, I think it was in the beginning of this document in the intro, you'll notice that we don't have any dollar amounts associated with this, but the one area that we did indicate some initial thoughts were around grants to all providers, and we said that we think we'll likely invest about half the funds in grants to all childcare providers. One of the things that we've looked at is we've talked to other states who have provided similar types of grants, and one of the lessons learned that they shared with us was try to make this as simple as possible for providers to access. And so one of the ways to make it simple is for the state to develop a funding methodology and determine how much money providers will receive, and then make the application for those funds very, very simple. So we are looking at developing some sort of an online platform that TWC would administer. We would not go through our 28 boards and ask our 28 boards to each develop 28 different systems. We would develop one system for use by all providers across the state. We're working with Childcare Regulation so that they will help us send notices out to providers. So providers don't have to write us to ask how to access the funds. We are going to push information out to all providers across the state, and then use this new online system for providers to request these funds. These are grant funds. They're not reimbursements for subsidies. So there are some different rules that apply. Generally, with the child care subsidy reimbursement, it's you just sort of earn that reimbursement, and providers can spend it on whatever they want. It's an earned payment. With a grant, providers will be responsible for tracking how they spent the funds, and we will be monitoring a subset of providers who received this grant to confirm that the grant funds were spent on allowable uses. So what we're thinking is to really simplify this and to make sure that we have a really strong paper trail, that we'd ask providers to spend it on rent or mortgage, utilities, personnel costs, and taxes. All of those things have very, very strong paper trails. Federally, it is allowable to spend it, for example, on PPE, but we're really concerned that you would go out and purchase this at a Walmart, at a Target, at a Sam's, and then you would lose that receipt. And if you don't have receipt, those become disallowed costs that you have to pay back. So by really focusing this on those items that have strong paper trails, we hope we're setting up all programs for success, because accidentally folks could lose receipts, and that could cause problems later. Obviously, then any of those other funds that you're collecting through tuition could be spent on all of those other items. And this money would be targeted at those 4 items that have strong paper trails. So that's kind of our high level plan at this point. We're working through a lot of the technical issues right now to get a new online grant application stood up. But as I said, this is probably our top priority right now. So with that, Shay, if you'll go to the next page. As we look at providing these additional funds, outreach and technical assistance through business support coaches is another activity that we're considering. The federal legislation does ask states to widely publicize and provide technical assistance to access these funds. So we'd like to see how we can contract for business support coaches who can help providers access these funds. We have heard from other states that oftentimes home-based providers may need a little extra coaching and assistance to make sure that they have strong documentation processes in place to really bifurcate personal expenses versus business expenses. And so that is an area that we're considering so that our home-based providers understand how they do have to track those funds separately. The next category you'll see in blue is assistance to providers not participating in the subsidy system prior to the pandemic. And I think we've already covered that. Our grants to all providers would address that strategy so that all providers, all eligible CCDF providers, regardless of whether they're subsidy, would have access to these grants. And then the federal government put in this last category called other. So under this other category, we've listed several kind of buckets that we're considering and projects under those. We reviewed this on the stakeholder webinar, and there's additional information posted on our website about this, but you'll see our first was Texas Rising Star support. We're trying to see, are there opportunities to expand Texas Rising Star capacity through the use of contracted slots. So contracted slots was approved in the last legislative session. We just approved TWC's rules to implement contracted slots, and the automation changes just went into effect, gosh, I think last week. So we're considering, are there opportunities to invest some of these funds in support of contracted slots models across the state? We're also considering parent outreach and education on the importance of quality childcare, noting that Texas Rising Star is our quality rating system here in Texas. We got a lot of feedback about the need to educate parents about quality, and from providers who really want to make sure that parents understand that Texas Rising Star is a quality program, so that as parents are making educated choices about where to send their kids, we're helping them understand Texas Rising Star. So that's one of our potential investments of funds. Then we have childcare capacity building. We have quite a bit of information that's being considered under here. And again, let me note that none of these decisions are final. These are all considerations. This plan to the federal government is still a plan, and states do have the ability to modify or make changes to this plan. So under capacity building, pre-K partnerships. So what great timing to hear from our public commenters today. This was one area that we were looking at potentially investing additional funds, as well as employer site-based childcare, registered early childhood apprenticeship program, and shared services alliances. I think our pre-K partnership and shared services alliance, as we think about our public commenters, those two strategies are really combined into one, looking at that United Way shared services hub for pre-K partnerships. So certainly there are opportunities to consider several of these strategies holistically as we think about future investments. Then we have support for early childhood professionals, opportunities that we have to expand professional development. We've also heard a lot about social, emotional, and behavioral health needs of children. And then finally, we have sort of this catch-all for studies, evaluation, and planning. We know that there are several reports that have previously been produced, and so we might have opportunities to update those reports. So at a high level, that's what's in the plan at this point. As I said, final decisions have not yet been made. I think you guys know we bring all of these types of decisions to our commissioners in a posted open meeting. We publish all of these things on our website so folks can see them prior to the meeting. But we're going to continue working on the implementation of these new funds over the coming months. And so Shay, with that, you can probably stop sharing the screen, and I'll see if there are any questions or comments, and if any members have any other COVID updates that they'd like to provide.
Again, this is Kim Comfrin.
Hi, Kim.
You know I have questions. So on the point of the grants, I have a couple questions. So I'm just going to ask them, then you can answer them however you want. Is there any other approval that has to be made at the commissioner level for that, or is that ready to go? And then secondly, what about, I know there's childcare regulations gave the temporary closure allowance. I don't know what Julie, you can help me with the right words. Like some that have just like they're temporary closed for a couple months because of enrollment, but they are planning on reopening. They're not permanent closures. How do they fit into that grant process? Is it they have to reopen and wait for that process? So those are my questions.
Yeah, so at this point, our commissioners do have to approve the grants to all providers. As I said, we had this high level plan where we said we think we're going to spend about half. We will need to bring forward an official approval document for exactly how much money and exactly how we're going to distribute those funds, based on what criteria.
Okay.
So that's the next step in that process. At this point, we are considering looking at open providers.
Okay.
Because we know that there are more funds coming to Texas if
Right.
that American Relief Plan is enacted.
Right.
Significantly more money.
More
And
money.
I think,
Right.
in fact, I think that's on the update for a little later on when we do member updates. But I mean, we are expecting to have much more money.
And I know you don't have a time frame yet as far as when everything's we're going to get the green light, the go button. Are you anticipating a time, like people can apply between X date and X date, or do you feel like it's going to be a rolling 3 or 4 month process that people can apply?
So I think we're probably going to look at, a quick application process between X and X date for all open providers.
Okay.
Right now we're looking at one-time grants. We've had conversations with a few providers across the state just to get a sense of, if we were to put out this much, about how long would it take you to spend it? We've had some discussions about signature authority. We've had lots of conversations with Julie Richards about their database and how their data identifies controlling persons within a licensed entity. And so we've been working through a lot of these very technical details about how we identify the person that's legally authorized to sign the grant on behalf of the child care provider. So we have to work through some of those technical things about making sure that we have the right person that's legally allowed to sign the grant.
Right.
In order to implement this.
Okay. Thank you. That's helpful. I have more questions, but I'll let other people ask.
I'll ask one or two.
Stephanie Rubin for the record.
Yes, and forgive me if I should know the answer to this. So without getting into too much detail about the criteria you're considering, have you been open to the idea of some criteria that would be weighted depending on, who's served, the need in that community, issues like that, if they're serving larger numbers of kids on subsidy, for example. So is that something that you've thought about, that you're considering? And then the other question I think goes back to Reagan Horchow's comment about data and integration. Are you, and it sounded like you were thinking about how to use some of the federal funds for the sort of data integration conversation, but if you could touch on that, that'd be great.
Yeah, we have been looking at what data do we have that might allow us to do some weighting. The biggest, in fact, during our stakeholder call, one of the comments that we got had to do with nationally accredited providers who may not necessarily be TRS because they haven't been part of the subsidy system. So that's actually something that we're looking at now. I mean, generally we look at somebody's Texas Rising Star status when we think about a quality bonus. But since this is open to all providers, that's the first thing, is that we do want to look at some national accreditation. Within Texas Rising Star, we have acknowledged several national accreditation entities. And so we'll be looking at those to see about potential bump ups in the grant amount. Some of the other areas are more difficult to consider at this point. From a subsidy perspective, the numbers in subsidy fluctuate, and we've actually seen some pretty significant declines at this point. It's difficult, and this goes back to this whole issue about what kind of data do you have, to really consider other areas because the data that we have on hand isn't as complete as it would need to be in order to do that. I do think this whole notion of how we integrate data is something. I know that we have our interagency. We have a team that meets every other week from an interagency perspective, and this notion of data integration has been something that we have been looking at. We recently have been discussing early childhood system integration and looking at what other states have done in this area. So it's certainly something that's on our radar, and that we do want to consider in the coming months. I'd welcome any of the other agencies, to chime in on this whole notion of data integration. I think we were really happy to see our PEAMS unique student ID project between TWC and TEA. It got completed on time and under budget, and it's so we've begun assigning those PEAMS numbers to all of those students effective the beginning of this fiscal year. So that's kind of the first step in looking at opportunities to improve data integration.
Hi, Reagan. Amber Scanlon for the record. If I could just ask you a few questions. And again, I'm newer to the group, so I apologize if I just need some clarification first. Can you confirm or correct me, but this 1.1 billion was allotted to help early childhood providers recover as a result of the pandemic, or was it just traditional expansion of block grant funding?
It's both. It was provided as an increase to the CCDBG Childcare Development Block Grant. It's for any allowable purpose under the Childcare Block Grant.
Okay.
But one of the requirements was that states do consider using a portion of the funds to help all providers in pandemic response.
Okay, that's super helpful. So one of my questions was about the virus mitigation section and how you, in your current draft of your plan, you weren't considering using the funding for that. My question just has to go back to the extensive amount of money childcare providers have had to spend on virus mitigation themselves. And can we, or would you consider reimbursement of those funds, because those are both significant expenses?
Yeah, so when we were thinking about virus mitigation, I think I'd have to pull up the plan again, but we were thinking of it from, are there any new standards or training or anything like that needed to provide childcare centers? From the issue of funding it, this was one of those kind of balancing acts that we were considering in the grants to all providers. If by providing grants to all providers and targeting it towards those 4 categories that I mentioned that have really strong paper trails, we'll be able to make sure that providers can document how they spent these funds, and that should free up other funds that they have to pay for all of these additional virus mitigation costs. Our thought was, if we include that in these grants to all providers, if they lose those receipts, those become disallowed costs. So by targeting these funds and freeing up their current funds, they will actually have more money to spend on virus mitigation, just without having to keep that detailed documentation for an audit.
No, I hear you. I guess I'm speaking more in reference to the money that they've already had to come out of pocket for. Those are real significant costs over the last year that those were never intended, probably in original budgets that they even have. I have a real concern about not addressing historical expenses these providers have had to bear to mitigate virus protection while serving as essential workers on the front line during this pandemic. That's a significant concern of mine, which kind of leads into my next question is, I think it's really well intentioned that you're thinking of how to make it easier on the provider to document their expenses and not lose receipts. And again, I'm not an expert in the work that you do every day, but have we gotten enough public comment from those providers to make sure that's what they need and they want? Like, I realize creating a system that's easy for the agency to document is great, but is it what our providers actually really need? And do we have enough of their feedback to make sure that just because it's easy to document, that it's the right thing to fund or exclude?
Yeah, so great questions. That is something that we highlighted when we had our stakeholder conference call. We haven't received any feedback that this that this strategy wouldn't work for them. We did reach out to probably a dozen childcare providers after that stakeholder call to have a discussion specifically about this, how the money could be spent. And we didn't hear concerns from any of those dozen or so that we talked to.
Okay, I guess my only just thank you for sharing the information. I guess what I would say is, do you think, you know, if moving forward in this and you have to look back on how it was done, is that one conference call in those 12 centers, is that representative of enough providers in the state of Texas?
Yeah, no, I totally agree. We have posted information on our website. We have pushed information out. We probably have thousands of folks on our distribution list,
Okay.
pointing them to our website. We actually created a new stakeholder email, and we've told folks, if you have comments about any of this, to please email us. We have received emails from folks. I don't believe we've received, I think Allison Wilson is probably on the phone, but to my recollection, we have not received any comments about this particular area on the use of funds.
Okay, thanks for answering my question.
Yeah, you bet. And Kim Coffrin asked in the chat, how long do providers have to spend this grant? That's actually a question that we asked, you know, gosh, if we put this much money out, how long do you think it would take you to spend it? And actually what we've heard from I think all of them said we could spend it really quickly. It wouldn't take long at all. I mean, I think obviously there's a great deal of need there. I think because we're putting it out at tax time too, there'll be an infusion. And so for tax payments, that a lot of programs said that could be beneficial as well.
And so Reagan, with that, it's costs moving forward. So once I get the grant, if I get the grant in May 2021, it's expenses from May 2021 on.
Well, we actually are having some discussions internally about, could we allow folks to go back to January 1st, for example.
Okay. More to come. Great. Thank you.
Yeah, more to come.
Hi, this is Julie Richards with Childcare Regulation. I just wanted to add to Reagan's point that we also sent an email notification to all providers with TWC's information about their new website and the posting, allowing all providers to be able to provide some feedback and opportunity to TWC.
Thanks, Julie.
I also just put that link to the website that explains how to submit stakeholder input in the chat box if any folks in the public have comments or questions. I do see some from Mr. Cohn in the chat. I think it's just to me saying that payroll is the biggest cost, and it's very easy to track, and providing just looking at the city of Austin and their grant and how that worked, using a similar rubric. The United Way helped do that, and I believe that we did look at their grant process. It was one of the first things we looked at.
Yes, thank you.
Hello, Reagan. This is Jolita McDonald. How are you?
Hi, Jolita. Good to see you.
Hey. So I heard you say that I had the same question as Kim Kaufman, and the question was like, what about the providers who are closed temporarily? And so you answer that like right now we're focusing on providers who are open, and there will be more funding coming in to come for those other providers as well. But what about the providers who have closed indefinitely due to COVID?
Yeah, so again, right now we are focused on those that are open. With this new infusion of funds, I think we'll have an opportunity to think about closed providers. What we need is a commitment from a closed provider to reopen if they're going to receive a grant. So if somebody is closed, they would need to have some sort of a reopening plan in place, you know, with a date. We don't want to provide a grant to somebody who doesn't plan on reopening. Again, they would end up having to pay those costs back.
Okay. Yeah. Thank you.
Good question.
There's a question in the chat from Catherine Abba. Is there a plan to wait or incentivize those in childcare deserts?
We have received that comment and we're looking into it right now.
This is Julita McDonald again. Will this application be an online process or will it be paper? How will it go?
We are
apply for the
looking at
grant.
we are looking at an online process, something where we would send a notice out to providers, and then you would submit information back through this online grants system. So folks could do it over their phone or on a computer.
Okay.
All right, other questions or comments? All right, it sounds like we are ready then to conclude with agenda item 6 and move on to agenda item 7, which is the cross-agency early childhood consumer education website. So Shay, I think we have some PowerPoint slides that we can share with folks.
Yes, they're loading right now.
All right.
There we go.
Okay. So one of the things that we folks at the state agencies have been discussing is how do we make information available to parents on early childhood services. I think we all know that in a mixed delivery system like Texas, parents have to go to multiple places to get information about all of the services that are available for their kids. So we've been having some discussions about how could we create a new website for parents that puts all of this information together and then points them out to the information that state agencies already have posted. So Shay, if you can go to the next slide. So right now, TWC, the Texas Education Agency, State Health Services, DFPS, and HHSC, we are all talking about how we can help integrate information about our services into a new integrated consumer education website. We're not talking about actually changing any of the information that the state agencies currently have posted. I know there is a lot of interest in additional work at state agencies to integrate systems or applications or any of those types of things. This is really our first step at creating a platform for parents to be able to see everything that's available from these state agencies. So Shay, if we go to the next slide. All right, this is an example from another state, Kids Central Tennessee. You can see the 4 bars across the top: health, education, development, and support. So parents have the ability to go to this type of a platform, click on one of these headers, and it pulls up a lot of information on services and supports that are available for their kids. So we're thinking, can we develop something similar in Texas? Next slide. So high level, we've got our interagency team, TWC staff and staff from the other state agencies will work on this. TWC will provide funding to help actually, program and get the website up and running. And as I said, we're not really talking about an overhaul of the agency information itself. We did receive a federal intensive technical assistance grant support. The Office of Childcare contracts with capacity building technical assistance centers. And one of those centers had an opportunity for states to request intensive technical assistance on a project. So we submitted an application and we will have support coming from this, this federal capacity building organization to help us as we design and develop this new web page. We want to do something that makes sense to parents. So this technical assistance group will be able to help us engage with parents so that we're designing something that speaks to them and that makes sense to them, that is user-friendly and intuitive and helps get them the information that they're looking for. So obviously looking for parent input, but we're really interested in how the council can help provide feedback throughout the development and design. And then once it's finished, obviously helping to publicize. So at a high level, those are our plans for this new website, and be happy to answer any questions that you guys have. Oh, thanks, Shay. Yeah, you'll see that these are a lot of the areas that we're thinking about right now for inclusion.
Reagan, Kim Coffrin. Timeline, what's you guys' I know this stuff doesn't happen overnight, so what's your hopes? There you go, Shay, good job.
There you go. So, we have already, thank you. I don't have my PowerPoint in front of me. We've already begun looking at other states' websites. Tennessee was that example that we just showed you. We're looking now that we have this federal partner identified to really try to confirm what information should be included in the website, how should that website be laid out, getting input from parents and stakeholders on the design. So you can see there that later this fall, we hope to be developing it based upon the input that we get through the summer, and then rolling it out late this year, early next year.
There is a typo. That should say 2022 at the bottom.
Yeah. Winter 2021, spring 2022.
And I'll just go back up to this slide if people didn't get.
Yeah. So again, this is really an interagency initiative. TWC was able to get that federal technical assistance, and then we'll fund the IT work behind it. But this is really something that all of the state agencies are working on collectively. So if you guys don't have any other questions, we'll certainly be in touch as we're developing this, but happy to hear thoughts or comments from you.
Reagan, this is Kirsten Schwab with Texas PBS. I was just curious if you have, will most of this information be kind of state related, or do you have plans to connect in resources from local communities and regional communities as well?
Yeah, so initially it will be state related. One of the things we would have to think through if we, as we start opening it up is what's the process for opening it up? How do you vet which organizations get included and which don't? So initially it will be a state for state related services. I think that is something that we can think through as we open it up to non-state programs. What sort of a process would we need to determine which get included and which don't?
Can I ask one follow-up question? Do you plan to provide this in other languages, for example, English and Spanish?
Yeah, I would assume so. Generally, I know when we put out our general childcare website, we do have it available in other languages.
Thank you.
All right, other questions or comments? All right, then I think we are ready to move on to our next agenda item on upcoming early childhood events. I think we have some slides on this too. And I think the first person we'll hear from is Shay on pre-K.
Yes. We just wanted to make sure that everyone was aware of a rescheduled from last year's summit that the Texas Education Agency and the Texas Workforce Commission are working on. It's a pre-K partnership summit. It's by invitation only, so it's not for the public to attend. But we wanted to let everyone know kind of the systems building work that we're doing across the two agencies. We are inviting workforce boards and their regional education service center that they're co-located with to come together and become a team, and we will provide them individualized kind of technical assistance. We'll do a kickoff meeting in April and a follow-up meeting in July to make sure that the workforce board in Houston, for example, is working really closely with the Region Service Center in Houston and helping give them all the tools they need to support and expand pre-K partnerships. So it's kind of a first big educational moment for these two groups to help them really understand what resources are out there and what pre-K partnerships are and how they can support and start to give them ideas around that. There will also be each local boards and education service centers have also been allowed to bring a few childcare providers or school districts that are also interested in starting up partnerships. So they will be included in the May meeting as well. That's it.
All right, thank you, Shay. The next update is from TWC. So we are going to be hosting a virtual early learning symposium this summer. We're actually doing this in lieu of an in-person summit. That summit was scheduled to be held early in the summer, and we're just not comfortable. Oh, I see Allison is on. Allison, are you able to speak at this point?
I am. Thank you.
Oh, good. Oh, good.
She's on it. Yeah, so as Reagan was saying, the summit that we usually hold each summer in partnership with TEA and the Office of the Governor, we did make the decision to, again, cancel this year the in-person event. It's an event that requires a lot of advanced planning, and we had to make a go or no-go decision back in early January, and there are just still a lot of uncertainties, as I'm sure you are all aware. So that in-person event won't be happening this June. However, TWC is planning a virtual early learning symposium that will take place over 3 weeks in the month of July. And we will be soliciting from the same pool of really amazing speakers that we typically have at the summit, but it will be an all virtual event. The webinars will be spread out over that 3-week period on Tuesdays and Thursdays. There will be 2 sessions on each of those days, one that should fall around the nap time hour for our childcare programs, and then one that will be in the early evening. So we're hoping that we're still going to be able to provide some really great training for our early childhood educators. So more information to come on that. And also I will mention that as we usually do, there will be content for both your classroom practitioners as well as your administrative staff.
All right, thank you, Allison. Sure. And I think next we're going to hear from Sarah.
Hey, thank you. So I'm gonna talk about 3 upcoming or 3 resources to share. The first is this Texas Fatherhood Summit, and you can see the link here for registering, which is also going to be held this summer. The Texas Department of Family and Protective Services Prevention and Early Intervention Division and the Child and Family Research Partnership at the University of Texas at Austin have partnered since 2016 to co-host this Texas Fatherhood Summit series, bringing together providers, policymakers, community stakeholders, dads, direct service providers, to really think about creating a more comprehensive approach to supporting Texas dads and their families. This is the 6th annual Fatherhood Summit with the theme of taking research to the field. And so I hope that for those of you guys that are able and interested to join us at that summit, that you can see the link here to register. In addition, through our partnership with the Child and Family Research Partnership at UT, we've co-created, along with some of our other state agency partners, the Fatherhood Resource Hub, which is sneakily hidden at www.fatherhoodresourcehub.org. And it's really meant for any organization invested in the well-being of families, including organizations that provide services to dads, but also parent-focused organizations, parent service organizations, family service organizations, and it's really resources that are research-driven and are aiming specifically at policies, infrastructure, operational ideas for how to support dads as they support their families. And so if you haven't had a chance to check it out, I hope that later today or in the coming week that you'll have a chance to check it out. And then finally, I just wanted to highlight, as we continue to think about these questions and ideas around data integration and how do we think about sharing data and how do we better understand the data that is available to us, I did want to highlight a sort of a collective approach to helping local collaborations and early childhood leaders better understand and use state level publicly available data. And so this spring and summer, we're offering a series of monthly virtual learning opportunities. The purpose of this session is really around unlocking the mystery around early childhood public data for Texas communities, really helping folks understand what's available, what does it mean, and how they might integrate it into their local work and planning. We are specifically focusing on data points around public health, child safety and family support, early education, and childcare. We are working and partnering directly with the United Ways of Texas to sort of coordinate and facilitate this series, and bringing in speakers from each of our representative state agencies, but also some other national and state level data leaders. And I do want to extend an invitation to our Texas Early Learning Council members to participate in these series, and we'll be following up with some additional information through Shay as a follow-up to this meeting, just to survey for interest and to get you connected with your local coalition or community team that may be attending.
All right, thank you. And then last on our PowerPoint, Kim.
Yes, so if you are following NACY's on their website or on their email list, you know that they have spent the last couple years developing the 4th edition of the Developmentally Appropriate Practice Book. And if you are an early childhood major, you know that's the green book that is our Bible. And so with the virtual world that we are living in right now, they too have postponed their normal professional learning institute that happens in June. So that won't take place until 2022, but in its stead, they are doing a developmentally appropriate practice symposium virtually June 9th and 10th. So it is a chance to, if you aren't taking a college class anytime soon on the DAP book, this would be a great way to give a quick shot about what has changed and updated in that book as our practitioners go forward. So if you're interested, look at NACY's website. Registration isn't open yet, but just put it on your calendars and stay tuned for more.
Great. I think we have one more slide, and Alferma.
Thank you, Reagan. I just wanted to share with the council that the National Head Start Association will be virtual this year. They did it like a modified version last year at the last minute when everything closed down in April. So it will be held April the 20th through 22nd. Registration is now open if you're interested. The link is active in this on this slide, and you can access it through the NHSA website. There's one part that they've added to it. It's like a virtual childcare event where they will look at childcares in different countries, and that will take 1 week. And it's a separate registration, but very interesting. I read about it. I just don't have time to spend a week from going through through that event, but I will be participating in the NHSA conference itself. The other thing I would like to share is that we, along with our partners with TEA, 2 partners from TEA and our Regional Head Start office, had scheduled a Transition to Kindergarten Summit that was scheduled to take place in March of 2020. And of course, COVID caused that to be rescheduled, but we had to reschedule it virtually. We rescheduled it for February the 23rd and 24th. And because of the winter storm, we had to cancel it again. We just rescheduled the dates last week to April the 27th and 28th. And this partnership was part of the initiatives for the Collaboration Demonstration Project set forth by the Office of Head Start to support better transitions between Head Start and ISD partners. So the demonstration project is over. And as a second to that, the Office of Head Start asked the collaboration directors to do a 100 school reach in all states that were participating. And we had 2 programs, 2 Head Starts and their ISD partners to participate in the demonstration. And then I reached out to 10 other Head Starts and their ISD partners to participate in this new, we call it the TTK Summit as our acronym. And we have, it's about 10 grantees, Head Start grantees, and 15 ISD partners who will be participating in this summit. And hopefully we'll be able to pull it off. I guess the 3rd time will really be a charm. So we would do this virtually. We do have a new director of Head Start now, Dr. Bernadine Fuller, but this initiative will continue to be in place and implemented. And the goal is to ensure that it is statewide at some point, but that will be years in the making because our state is so big, we have to do this one step at a time. So those are the 2 things. The other things that are noted here are things that April had indicated in the PowerPoint. She had noted those. She sent those to Shay.
Thanks, Alsara. I can talk for just a minute about the other events. The next 2 bullets, the advanced coaching workshops and advanced trainer workshops, those are statewide open trainings available to support anyone who is a coach or a trainer working with childcare professionals. And the training is centered around the competencies for coaches and trainers that are on the Texas Early Childhood Professional Development System. So those will be free, available at no cost. They will be hosted virtually. And there are about 15 hours of training for each track. So we're really excited to still be able to offer that virtually. And really what we've heard when we hosted these several months ago, right after COVID-19 kind of hit, was that one of the huge added benefits of us taking it virtual is that we're actually really helping coaches and trainers learn more about how to intervene and support staff virtually. So we hope that it's helpful in that way too. The Infant and Toddler Specialist Network trainings for infant and toddler specialists, that one, there will be 6 hours of training there, and it's tentative for April, May. That again will be open, and the ITSN website has a lot of additional information about signing up to participate in those. The Infant Toddler Specialist Conference was intended to be in person. We are pretty certain it's going to be virtual, and that was planned to be a 2-day event. So we're looking at moving that virtual for this summer as well. And then Lunch and Learns are also open statewide virtually. And for this session, we're focusing in April on helping schools parents learn to use their progress monitoring data to make decisions for instruction and for supporting kids at home. And then we're also getting close to wrapping up statewide events for the Texas early childhood professional development system rollout that has a focus on onboarding all TRS providers and their staff into the TechPed system. I'm happy to share additional information about any of those events with anyone that's interested.
Thank you very much, April. We're all getting good at these virtual events, aren't we? Do any other members have any other events that they want to make us aware of? All right, then we are going to go to our next agenda item, which is updates from Early Learning Council members. And first, we have some invited folks here. We're really fortunate that Stephanie invited one of her colleagues from Texans Care for Children to be with us today. David Fagan is with Texans Care for Children. He's an early childhood policy associate, and he's joining us today to provide us with an update on their new English childhood English language learning roadmap. So is David on with us?
I am. Can y'all hear me okay?
Yes, great.
Okay. Well, good to be with you all this afternoon, and I appreciate the opportunity to tell you about this exciting partnership that we launched, I guess, technically early last year and more officially early this year. And so thank you again. And this partnership was really led by a steering committee that included Texans Care for Children, Philanthropy Advocates, Intercultural Development Research Association, Dr. Dina Castro out of UNT Denton, and of course the council's own Kim Coffrin from the Texas Association for the Education of Young Children. And so the group of us helped lead this project to really take a look at the young English learners in our state and the education environments where they're learning and release a policy roadmap to talk about where the state can go. So I'm going to talk a little bit about that today. Shay, if you can move to the next slide for me. Unless I have that control. I don't think I do. Okay. So if you were really to try to understand in 2 sentences why this project was launched, this would be it. You know, that early childhood is essential to English learners' success. I don't need to tell anybody here that the first years of life are critical for children's education. Early childhood education is incredibly important for all kids, but as anyone here who's worked with young children, had young children, you know that the first years of life are really, really important for language development. And that's particularly true for our young bilingual children. So making sure that we get these years right, that they have the right supports is really, really important for their development. And with 1 in 4 Texas students categorized as English learners, they are critical to our entire state's success. That is the highest percentage in the country. We just recently passed California by that metric. So we have the highest percentage of English learners in the country. So we know for the state to meet its early literacy goals, its career and college readiness goals, we really need to look at these children specifically. So some of the challenges that also, you know, precipitated this work and was reinforced by it were that, you know, we need more funding for these bilingual programs that's dedicated to bilingual programs in the early years. We need more state guidance and standards. Not nearly enough children have access to quality dual language immersion programming. For those children who are in you know, the pre-K through 12 space, it's only around 18% of English learners who are in dual language immersion programs. So we know we have a long way to go. We know that dual language immersion is the best way to not only teach children their home language, these children their home language, but to teach English as well. There's a great deal of research enforcing that. So, you know, we know that that's a big problem. And perhaps more than anything else, you know, it's the support for our educators. You know, in the childcare space, obviously we know that we need to support them in many holistic ways. And in the pre-K through 12 space, we just have had a long-standing shortage since the early 90s in certified bilingual educators. So they need better support. We need to do more to recruit and retain them. And we need to make sure that we can actually get them certified. And then finally, you know, we just need more data collected, better data collected, you know, starting in childcare and into those grades. So that's something that our policy roadmap tries to speak to. The next slide, please. So of course, COVID-19 happened, right after our project really launched. So we all had to get together and say, what has changed as a result of this? Is this still the right issue? And the more and more we spoke to schools and other practitioners, childcare programs, we saw that unfortunately the issues hadn't changed too much, but the urgency had changed quite a lot. Through the TEA survey that has been discussed, of which children have missed distance learning, what we've learned about digital access and digital literacy. We know that our young English learners have really missed out on critical structured learning, distance learning, and language development has really been stalled. Even for the young English learner who has quality internet at home, has an engaged parent helping them with their internet at home, it's just a very difficult way to teach language, for especially bilingual language. The power of dual language immersion, as we've come to find, is that children are interacting with each other, that they're interacting with their teachers, they're teaching each other language. And that's so hard to do virtually. So in these critical years, we know that the impacts could last for many years, and for our young English learners, it's a particular concern. So on the next slide, I won't spend too much time on this, but I'll just say that our project really broke down into two phases, sort of the research and data collection piece and the policy agenda making piece that happened sort of in phase two. So we did a survey of around 185 practitioners and experts and stakeholders, advocates, who really talked about what are the challenges and opportunities, what are the primary things that would make a difference. We did around 15 interviews of practitioners in El Paso, Dallas, and Bexar County. And we wrote up some spotlights of those communities that'll be available on our website here soon. And we also built the policy roadmap. That steering committee led this work, but we had an advisory group of folks around the state. It was one of the benefits really of everyone being virtual, is we had planned to go visit these places in person, but everyone got so used to Zoom that we were able to bring people from Amarillo, from El Paso, all together. So I do think that's one of the great consequences of this moment in history, is that we're all a little more used to connecting this way. And we had 3 2-hour convenings that really looked into these issues. So on the next slide, our policy roadmap was born, and you can find it on bilingualtexas.org. It contains recommendations to the legislature, state agencies, schools, childcare programs about implementing smart strategies for young English learners, all of which sort of towards the goal of making sure kids become strong readers by 3rd grade, making sure that English learners are fluent and literate in English and their home languages, and making sure they're just learning in settings where teachers, childcare directors, and parents have the tools that they need. So on these next slides, and I won't be able to spend a ton of time here, like I said, there's around 40 recommendations in the roadmap. I really encourage you to review them. We have them broken out in different ways for different people's interests. You can look based on who the recommendations are directed at or what kind of issues they're seeking to address. So I encourage you to play around with that. But they're really around sort of creating a state strategic plan to increase the number of certified bilingual educators, the number of dual language immersion programs, the number of children who graduate with a seal of biliteracy. That's something we're hoping to see this session, making sure that the state broadband plan includes real plan around digital access and digital literacy for families who might have the towers in their area, but don't have the means or the digital literacy to really engage virtually. On workforce, creating a certification in bilingual special education. I will just say that bilingual special education and English learners with disabilities and developmental delays was one of the clear takeaways from this project. It's a huge issue. Every practitioner brought it up. We just need more people in our schools who are able to identify these children and provide them a bilingual special education in a culturally responsive way. So that's what that certification is seeking to do, and there's legislation already filed to do this. So other pieces, if you go to the next slide, Shay, we have some recommendations on data collection and student progress monitoring, starting in childcare and continuing through high school, really making sure that we have a process to identify English learners and potential English learners and make sure that, you know, we're identifying them even after they've exited an ESL or bilingual education program. This is something that's very important, that when we make sure that students are, you know, get to be English proficient enough that they get into general programming, and we sort of forget that they were once categorized as English learners. So making sure that our data reflects that. And then if you move to the final slide, we are looking, of course, at school finance. It's obviously very important for the dual language early education allotment. We took some really strong steps last session. But as I mentioned, as we talk to folks, we still need to provide more dedicated funding to bilingual education. We need to make sure that our House Bill 3 cleanup really includes a focus on the dual language allotment and how it's been carried out, especially in these early years. And we just need to look for, you know, making sure that we're keeping up with the cost of inflation. So, you know, I have our contact information there. I know I went through this quickly. So please reach out. I also included the contact information from our counterparts at IDRA, who are a great resource on all things bilingual education, and were a great partner to us in sort of merging our early learning focus and their sort of educational equity focus. I think that was a big key to the success of this work. So I don't know if there's time for questions or not, but please reach out, and I'm happy to talk to anyone about this at any time. Thanks.
It seems that Travis Armstrong has a question.
Hi, yes, if we have time, and I'll be very brief. And David, thank you very much. This was very informative. I'm the early childhood director in our school district in North Texas. So we have a director of foreign language services. So I don't pretend to be the expert with bilingual instruction at all. But one of the conversations that she and I have had when we're looking at classrooms that are a blend, whether it's a bilingual pre-K classroom or bilingual kindergarten classroom, or something very, very niche like what you're just what you discussed with bilingual special education. And what, the conversations you've had over and over, and I'm going to hit the summary just since we can move on. The test is the certification exam to be a bilingual educator in Texas has 4 different sections to it. It's a pretty big mountain to climb from my understanding, and I know a lot of our teachers that are very talented teachers, native Spanish speakers, have not been able to pass certain portions of the exam. And I just wondered if, and again, that's not my area of expertise, but I just wondered if there's any discussions at the state level, and I don't know if there's federal strings attached to it, or but making the with having such a shortage of bilingual teachers, and then having such a huge mountain for them to climb, so to speak, to be successful on the all of the different portions of the examination seems counterintuitive, maybe. I don't know. I just didn't know if there was any discussion or any attempt to look at the examination, and how can we make it more feasible for teachers to get into the bilingual field. So I don't know if that's in your specific area, your lane or not, but I wanted to ask that question.
Yeah, no, it's exactly spot on. You hit it right. I think there's been a lot of research around the challenges with this test, around how in many cases it's actually not even culturally appropriate. In some cases it's really kind of biased towards certain experiences, and we make it so hard for ourselves between the exam, between everything we ask bilingual educators to do once they're on campuses. They often serve as their district's translators. They're asked to do quite a lot. So yes, we are very interested in looking at the test and making sure that it is actually really overhauled and making sure that it's hitting our goals. I think it was sort of perhaps a well-intentioned overcorrection for a test that was once considered way too easy and way too, it might have been a bit of an overcorrection. So I think we do need to return to that. And that's one big reason why we want the sort of state strategic plan, because there is no way to increase the number of certified bilingual educators until we really look at that test. So if we can get the state to rally around some key benchmarks of success, then I think we can change that test.
That's awesome. Thank you so much, David.
Thank you. And I also just wanted to mention that we have a briefing this Friday, well, next Friday, a week from today. And that information is on bilingualtexas.org as well. So if you go there, it's sort of our one-stop shop for the policy roadmap, our upcoming community spotlights. There's a short video from me kind of talking about the work that's there. So I encourage folks to poke around there. And it's a briefing that's a legislative briefing, but we encourage partners and practitioners, anyone to attend, because I think it's good information. So thanks.
Great presentation, and that's a very easy website to remember.
That was the goal. We played with ecell.org and thought that was not so good. So yeah, I'm glad you think so.
Yeah, that was great. Thank you very much, David. Okay, so member updates. Let me see. Sarah, we had you down. I want to see, do you have any additional updates that you wanted to share on, or did you already cover everything previously? Okay, I'm going to guess that she covered everything previously. Is Monica Martinez with us today from the Texas Education Agency? Wonderful.
Yes,
Monica, I think you have some updates.
Yes, thank you so much. And I will try to be brief, but did have some exciting news to share. And that is that we have collectively been able to identify a new interagency director for early childhood. I did want to share with this group that we were incredibly fortunate in that we had a very robust and competitive applicant pool. So it was really exciting to see all of the interest from many talented individuals for this particular position. And so we, after going through a fairly lengthy and robust process, we have identified and offered the position to Megan Schneider. To give you a little bit of information about Megan, she has a variety of experiences. So she served as a kindergarten teacher. She also has done some work in research and data collection specific to pre-kindergarten classrooms through a U.S. Department of Education grant. She's worked for a couple of nonprofit organizations here in the state of Texas on a variety of issues, some closely related to our work, some a little more broad. And currently, or most recently, I should say, she has been working at Deloitte and has really been focused on bringing different stakeholder groups together to work through a variety of different issues where, you know, we've got a lot of folks at the table with a lot of ideas looking to achieve some very similar goals. And so I know that other members of our interview committee, including Reagan, are here who can also speak to this decision, but I think we are collectively going to be in really good hands with our next interagency director. And unfortunately, Megan hasn't started yet. She will begin with us on March 15th, so was not able to join us for this meeting. But we will be working together to make sure that there are opportunities for her to meet members of the council and others who are very closely tied to our work. So just really excited about that. And then the other position that I know folks in this group are interested in is our Director of Early Childhood Education. So shortly after the interagency position, we did post the director position. As I think all of you can imagine, we knew going into it that we had some really big shoes to fill in losing Jackie, and we have been working through that process, but it has certainly proven, as we anticipated, to be much more challenging. So we have not yet identified the right fit for that position. but we are working diligently to do that. Our deputy commissioner has been very much involved in that process because of the importance of the position. And so while we are eager to get it filled, we, I think, are more concerned with making sure that we find the right person for the job. So my hope is that by the next meeting, we will have some additional news to share on that front.
All right, thank you very much, Monica. Any questions from members? All right, thank you. Good to see you. Okay, I have some updates from TWC. As I mentioned before, when there were questions about closed providers accessing the current child care relief grants, I mentioned that we are looking at new funding coming down. So I want to talk a little bit about that. So the American Rescue Plan, I believe is what it's called, does contain, again, I mean, I thought 1.1 billion was significant. This contains even more money. And Amber, this kind of goes to your question about, is this regular child care or is this funding specifically to respond to COVID? So there are actually a couple of provisions. One is regular child care, and it's a one-time infusion into the block grant. Texas is estimated to receive $1.7 billion. That's regular CCDBG. In addition to that, there is a stabilization grant for child care providers. So these are kind of like the grants that we've just been discussing. The Texas estimate is $2.7 billion. This amount of money is staggering, quite frankly. On the stabilization grants, there are some in the draft language. So in what passed the House, there are some additional requirements that are placed on this. We're not sure what it's going to look like on the Senate side, but on the House side, there were some requirements that asked any provider receiving funding to help pay for tuition and parent fees for families that are having issues affording childcare. It's really unclear how that would be implemented, how providers would have to document and show which families they decided to help. There are requirements that as state agencies make grants available, we consider a provider's operating expenses. Well, that's 14,000 providers' operating expenses that have to be considered. So the type of the mechanism to put out the money may have to look different if we actually have to consider how much a provider is making right now and take that into consideration in the grant amount. So the expediency of getting grants out it just could look a lot different depending upon how many requirements are contained in the final legislation. These are one-time infusions of funds. So again, 1.7 billion for any CCDBG allowable and 2.7 billion for stabilization grants to child care providers.
And Reagan, when would those have to be expended?
We would have this fiscal year and 2 more. So by the end of fiscal year 2023. All right, we're keeping our eyes peeled for that. We were also asked, I can't remember who asked us, if we had any updates on the winter storms and impact to childcare. So I'll tell you on the subsidy side, we have asked our boards, have there been impacts with your subsidy providers? What we know now is on the subsidy side, 37 programs had to close, 9 don't expect to reopen, 9 aren't sure if they're going to reopen, and 19 said they will reopen. We've been working with our boards to understand the costs that providers are having to incur to respond to the damage, to understand if CCDF funds could be appropriate to help with some of that. Some of the challenges we have in using federal funds is that we have to wait to see what insurance pays. And there are requirements that we can't spend CCDF funds for things that could have been covered by insurance, but a provider elected not to get insurance. So if a provider chose not to have an insurance policy, there are restrictions from us being able to use our money to pay for that. So we do have a few things to work through to understand what would even be allowable for us to spend to help providers. But we are looking into that right now. And then Kim, I had understood that you guys, I don't know if there's anything that you want to add.
I'll add what it's coming. So, but we are working with United Way of Texas to set up a donation page to help providers. Sorry, my son has a pizza in the oven. If you hear the beeping, it's the timer. Working from home. At least he can make his own pizza. He won't starve. Anyway, I've had several colleagues from across the country ask about how they can support childcare after our storm. So we're going to hopefully make that page public either today or Monday, and then we'll start taking applications from childcare providers who need help and assistance. Have no idea how big that pot of money will become, but it's a place for people to give, and hopefully we'll be able to get some help out. So stay tuned. I'll email it, blast out, and send it to Shay so she can send it to this group as well.
Fantastic. That's great. Great news. A couple of other quick updates from us. Shay, I don't know if you can show the Childcare Industry Partnership webpage that has gone live on the TWC website. We have just rolled out a new grant program. Our commissioners approved up to $5 million to serve as a matching grant opportunity for boards who enter into partnerships with private employers or corporate foundations to improve the quality of childcare. So what we've done is dedicated funding on a matching basis. So if you're able to leverage funds from an industry partner, a corporate foundation, because they want to invest to improve the quality of care, we will match that dollar for dollar at the state level and double the money that those private partners have put into the project. We are really looking at how we can fund strategic quality improvement efforts. So we've included a list of allowable types of activities. You'll see apprenticeship, improvements for home-based childcare, pre-K partnerships, business supports, wage supplementation and stipends, emergency response and recovery, program capacity expansion. We did include an other category because we know we can't think of everything. What we're really trying to avoid are, we know that there's a need to buy playground equipment, to buy defibrillators, to buy security equipment. Those are things that are allowable with the federal funds, but what we're really looking is for more strategic efforts to advance the system. Those types of activities can still be funded with the board's quality improvement funds that we allocate to them. But for this child care industry partnership program, we are looking at some more comprehensive strategic types of investments. We are about to release, we call them WD letters, workforce development letters, to all of our boards with these instructions, but the website is live and is out there, and wanted to make sure you guys were aware of that.
Regan, Amber Scanlon, can I ask you a question about that?
Yes.
The grant matching is for the Workforce Development Board to partner with someone else, a corporate foundation. Is that right?
Yes. So if you have a local entity, a local private corporate foundation that wants to invest in pre-K partnerships to expand their availability, and they donated $500,000 locally to the board. The board would apply to TWC and we would match that with $500,000 of our state money to make it $1 million.
Is the board a 501c3?
Many of our boards are, yes.
Okay, I would just say that those are just, I represent a corporate foundation. Yes, I do. So we aren't able to, and I would imagine many other corporate foundations are not able to provide funding an organization that's not a C3. So if you have boards that are not C3s, I would highly recommend, if you can, I can't tell you how to do your work, but if there's other ways to think creatively through that, preclude us from engaging.
Yeah, actually, that's a great comment. This is something that we worked on this week. The initial guidance that we had put out said that the donation had to be made to TWC, and that caused a problem for many foundations who cannot donate. So we have modified the instructions to allow that donation to go to the nonprofit board. So thank you. I'm good comment.
Okay, thanks.
All right, and then
What I was gonna say, one quick question. This is Kim. Is there a cap to how much they will match?
Yes. So for the first 6 months, we have placed a cap per board. I think it's $250,000 for us to match 250. After that, we have lifted that cap. We want to give everybody a chance to get it. And then after that, we lifted the cap, and oh gosh, Allison, do you remember what we lifted that to?
I do not off the top of my head, but I can find it for you.
We'll get back to you in just a second. I think it went up to 500, but I can't remember. Okay. The other update that we wanted to provide you is on our webpage, Childcare by the Numbers. So this is a webpage that we rolled out, last year. And when we first rolled it out, it had some basic information about Texas Rising Star. We have added new information to this. And so, Shay, if you will scroll down onto the webpage, you will see at the bottom this chart. And you'll see that on the left, it has statewide and then board by board areas. And Shay, before you click on that, if you'll scroll down a little bit more, I want folks to see one of the new additions that we've made is downloadable data. We had a lot of folks who had said, you've got this data on there, but I have to data enter it into an Excel spreadsheet to do anything with it. So this was one of the new enhancements. You can now download the data. If you scroll back up, Shay, and you click statewide, then you'll see home, annual view, and print. If you do not click annual view, you're going to be looking at the most recent 15 months of data. If you click on annual view, it's going to go back in time, back to like fiscal year 2015, and it's going to give you some history over time on what we have been looking at. You'll see data on there on the number of TRS providers, on the number of kids in TRS providers, breakouts by 2, 3, and 4 star. We've added information on the age ranges of children that we're serving, information on the types of childcare providers that parents are electing to send their children to, which in Texas, the vast majority of parents are sending their kids to licensed childcare centers, not to home-based providers. But just want to make you guys aware that all of this information is now out there. I will say that this continues to be a work in progress. We want to add data to this. And one of the data elements that we're actually looking at adding are more demographic information. And so based on David's presentation, one of the things that we would be adding is primary language spoken at home. That's one of those required data elements that we collect. So that will be a future enhancement to this webpage. So we're also interested in how we can put more information about employment outcomes for our parents, since we are at a workforce agency. And one of the things we want to do is help these parents get jobs, keep jobs, and earn more income. So just an FYI, we'll keep working on this. And with that, those are all of my updates. We are right at time, but I do want to see if there are any other members that have anything that they want to share with the group.
This is Allison.
Right.
I found that number. So after the first 6 months, it's up to 750,000.
Thank you, Allison. All right. Well, folks, with that, I mean, we hit our 2 hour right on the nose. It is 1 p.m. So with that, we will, I'll thank all of the members for being here, thank the public who attended, and we will close this meeting at 1 p.m. Look forward to seeing everyone at our next meeting. Thank you.
Thanks, Reagan.